Since beginning our breast MRI program, we have always had an automated means of lesion localization. As such, we have not gained any significant experience with manual localizations. For the purposes of completeness, we will give a demonstration here of a method to perform a manual localization. The first step in performing a manual lesion localization is to place a fiducial reference point into the grid. When you place your fiducial, be sure you're aware of the general location that you expect your lesion to be in and place the fiducial remote to that so you don't interfere with your procedure. Once you've placed your reference fiducial, mark on your MRI grid worksheet on the patient view the location of the fiducial marker. Having placed your fiducial on the grid and obtained your initial sagittal localizer scan, initially navigate till you find your fiducial, and then move to the slice section that demonstrates the skin surface. At this point, place a cursor on the fiducial and record the slice depth. Next, navigate to the lesion in interest. As this is merely a demonstration, we did not administer gadolinium. For the purposes of discussion, let's assume that our lesion is in this location. Initially, place a cursor on the lesion. First, navigate to the grid to make sure that your lesion is accessible within your grid. As you can see here, the deepest portion of the grid is here. We are within an accessible region. Next, again, navigate to your lesion and note the slice depth of your lesion. Next, subtract the slice depths of the skin surface and the slice thickness to obtain the Z depth for your introduction of your needle. If you're using a needle guide, be sure to add the thickness of the needle guide to this depth. Having calculated your Z depth, note the position of your lesion within the grid relative to your fiducial block. In this case, it's 2 blocks superior or towards the patient's head and 1 block deep towards the chest. Then also note the position within that block space of your needle positioning. Record this block on your MRI grid worksheet in the image view section, and then be careful to appropriately transfer it to your patient view section. So in summary, place your fiducial, find the fiducial, navigate to the lesion, make sure your lesion is accessible, find the depth of the skin surface at the block where your lesion is located, and subtract that from the slice depth of your lesion. Be sure to add to it any depth for an introduction block if you're using one, and then record the relative position of your introduction relative to the fiducial marker.